Jennifer Woodward, a geriatric medicine physician at Northwestern Medicine. My key motivation to starting a virtual memory care clinic is to improve access to care. This is near and dear to my heart because I grew up in rural Western North Carolina with my grandparents, and I remember them having to travel several hours to appointments. My hope is with telehealth or virtual care, we can improve access where patients would not have to travel for appointments. This is especially true for older adults who may have mobility issues or advanced dementia that can make it very challenging to come to an in-person appointment. Another advantage to virtual memory care is the services we provide to the caregivers and family. So we spend a lot of time focusing on education, support, caregiver resources, connecting them to support groups, and providing education about the diagnosis and advanced care planning. In my prior experience with virtual memory care, we have received very positive feedback from both patients and their caregivers. They find that ease of access, convenience of the appointments, and the being able to do the appointments in their comfort of their own homes is very beneficial. One way that we can address technological barriers is by having the social workers meet with the families and the patients beforehand to ensure that they have internet, video access, and do a kind of trial run to see that everything is working. Some of the challenges in setting up virtual memory care have been logistics. In my in-person clinic, our social worker and I would do the visits together, but in our virtual clinic, the social worker has a separate schedule. So we've had to work on ways to do the visits with the social worker prior to the provider appointments. Additionally, we had to come up with a plan for how to get our new patient packets filled out. Normally, a patient would come into the office and we would do these in the office. However, they won't be coming in, so we're setting them up into our electronic medical record so the patients will receive these documents before their visits to complete electronically. One way to ensure that the virtual memory clinic maintains standards that are comparable to in-person visits is that we will be embedding all aspects of our in-person visits to our virtual clinic. For example, it's very important when you're seeing patients with dementia to speak with their family or caregiver separately. They provide so many components of the history that you may not get from the patient alone. They often also speak about sensitive subjects and they don't want to speak about that in front of their loved one. So one of the ways we can do this in a virtual environment is by planning beforehand to have them in a different room than the patient so that we can speak with both the patient and then this caregiver separately. If that's not an option, then we set up a meeting or a time to call the caregiver and speak with them. We hope that with our program, we can show others how to set up virtual memory care successfully, have this as an option across the country.